all hear me? Okay. My name is Dr. Tammy Gilbert. I am a physical therapist, but probably more important for you guys to show some relevance is that I am a scleroderma and PH survivor. Systemic scleroderma for 12 years and pulmonary hypertension for 7 years now. So speaking from the medical background, but also definitely from the patient background, I hope we'll bring a little bit more significance to all of your lives. So today we're going to talk about posture and the effects of bad posture, as well as everybody started to change their posture now. That was quick, but we're all done. And how good posture is going to help you breathe better. We're going to talk about the difference between chest and diaphragmatic breathing and why we need to be breathing from our diaphragm. We're also going to teach you how to do it and finally end up with how to expel some of those fears we have when we hear that word exercise. All right, so just to a review for proper posture, we have 4 curves in our spine. The first is the cervical, and it goes slightly inward. Your thoracic spine here curves slightly outward. Your lumbar curves slightly inward, and then the sacral curves slightly outward. Anybody sit like this? All right, so this is considered poor posture. I don't think I have to explain this too much, but we have the forward head, the rounded shoulders, the rounded upper back, and the rounded low back. This posture can have very negative effects on our body. And a lot of this, as technology is improving our ability to access a lot more, it's also kind of worsening our posture because we're spending so much time in front of the computer, on our iPhones, our tablets, our notes, and we're not getting up, and over time throughout the day we end up like that. So how does this affect your life? If you have this forward head posture, this is going to increase the forces placed on the muscles in the joints in your neck. And over time, this can develop jaw symptoms, or TMJ. It can also lead to headaches and a chronic neck pain. When we see patients in physical therapy that come in with any type of neck pain or headaches, the first thing we change is their posture. And we get them in a better position to take the pressure and the forces off those muscles in the neck. Next, when you're in those rounded shoulders, this increases the stress placed on the muscles and joints in the shoulder and shoulder blade. And if you look at these list of symptoms, has anybody in the room experienced any of those? Shoulder pain, shoulder tendonitis, bursitis, impingement. And this is just a simple way to see how posture is going to affect your ability to move your arms. So if everybody, a lot of you have already switched your posture for me, which is good. So try going back when you first came in the room and you were sitting slouched. That slouched posture. And what I want you to do in that slouched posture, try and raise your arms up, sitting slouched. And just kind of notice how far you can raise them up. If it's stiff, if it's painful, any stress on, you can put them down, any stress on your neck, your low back. Then what I want you to do is try and sit up nice and tall. Good. Now try and raise your arms up again. Wow. Anybody feel a difference?
Yes.
Big change, and that was just a simple posture correction. And then everybody's arms moved a lot quicker that time as well. So that's just to show you the importance of posture. All right, when the upper back starts to round out too much, we call this kyphosis. And how this can affect you, it's going to decrease your physical performance. You're going to start to walk slower. You're going to have trouble getting in and out of a chair without using your arms. Your balance is going to be affected, which means you're going to increase your risk for falling. You're going to have difficulty reaching for things, all things that scleroderma patients already have difficulty doing. So we don't need to have this bad posture to make it even more difficult just doing simple tasks. And what's really important, I think, to a lot of us with lung condition, problems breathing. All right, in the low back. So if we're sitting like this all the time, eventually it can lead to your disc being compressed. You can get a bulge, you can get it herniated. Over here on this side, this is just an example of your spinal cord. This is the vertebrae here. In between the two vertebrae are the disc. This yellow is the spinal nerve that runs through the openings of the vertebral column. This is a herniation right here. So when your disc is compressed or herniated onto this nerve, your nerves get pinched. It gives you those symptoms of the numbness, the tingling, the burning, the shooting pain. Anybody ever felt that in your back, lower legs, arms? Not fun. So one of the treatments when somebody comes in with a disc issue is we get them out of this posture up straight. So, are your wheels aligned? This represents bad posture. This represents good posture. When you're in bad posture and your wheels are out of aligned, if you try to turn this, it's going to be very, very difficult. Over time, it's going to make you fatigue quicker. You're going to have decreased endurance, and the muscles, because they're not in their correct alignment, they're going to have trouble working. Over time, this is going to lead to muscle strain, muscle pain, decreased endurance. For this means that you're not going to be able to do your daily functions. So this is a nice summary of posture. So probably what most of you guys came for, how does posture relate to our breathing? The first thing I'm just going to talk about a little bit is the diaphragm. This is a large dome-shaped muscle, and it sits at the base of your rib cage, and it needs to be sitting at its correct position in order to function the best. It's at its best position when we're sitting up nice and tall and we're not in that slouch posture. When you go into that slouch posture, the diaphragm goes, its wheels are out of alignment, so it's having a harder time to function. To get that diaphragm to be the wheels aligned, we have to go back into that good posture. So if your diaphragm's not working the best it can, your breathing's going to suffer. So what is diaphragmatic breathing and what has to happen? As you inhale or take a breath in, the diaphragm gets pulled down. So this is a representation of the diaphragm right here. So as you take a breath in, this comes down to fill those lungs with maximum amount of oxygen. When you breathe out or exhale, the diaphragm gets pushed back up. So here, the belly goes out, and we're going to review this and I'll practice this. The belly's going to go out when you take a breath in, the diaphragm comes down. It's being pulled down so those lungs can expand to fill it with oxygen. So if you're getting more oxygen into your lungs, you breathe better and you have better endurance to do everything you need to do throughout your life. Breathing out, the diaphragm comes back up as the belly goes in. Now, if you're not sitting properly, this can't happen. The diaphragm can't come down. If it can't come down, the lungs can't fill with air. So diaphragmatic breathing is the most natural and healthy way to breathe. It's the most efficient for your respiratory system. And this is just kind of a summary of what has to happen. When you inhale, your belly goes out. When you exhale, your belly goes in, and then inhaling, your belly goes out. And we're gonna practice this in a little bit, and I bet you most everybody in here is doing it the reverse. So if you're not breathing from your diaphragm, most of us are probably chest breathers. This is a very inefficient way to breathe. Instead of using the muscles in your neck and in your diaphragm, you're using the muscles in your neck to breathe. And what happens is over time, these muscles can become tight, and that itself can cause pain. This is a group of muscles called the scalenes. And these muscles can help you breathe, but it's not their main function. But if you start using them too often, they're going to become tight. Importance is through these scalenes runs this large group of muscles called the brachial plexus. When these muscles get tight here, it pinches on the brachial plexus and again can cause those nerve symptoms: sharp, shooting, burning, tingling. This group of muscles right here runs all the way down to your hands. So in clinic, when we see patients even with carpal tunnel or any type of hand symptoms, we will go and look, one, at how they're breathing to see if they're using their neck muscles, to get them to start breathing from the diaphragm more, to take the pressure off the muscles in the neck. These are two other muscles that are involved in chest breathing. One is the upper trapezius, and this is really easy to find. If you just place your hands right on top of your shoulders and kind of rub, and if it's sore and achy, we hold a lot of tension in here. But these muscles also help with breathing. So if you're not breathing from your diaphragm as good as you should, you may be using your upper trap muscle. This muscle can lead into the neck here and cause neck pain and headaches. The sternocleidomastoid here is another muscle that we can use to breathe if we're a chest breather. It's this big muscle right up in here. When that gets tight a lot, it can cause jaw and TMJ problems. And I know that's a lot of scleroderma patients have a lot of problems with chewing and TMJ symptoms. So this is just kind of a good slide that shows just how it can be a vicious cycle. So even if you were probably the 1% of the population that has the best posture in the world, even if you breathe, if you don't breathe from your diaphragm, you're using those accessory muscles to breathe. You're using those neck muscles to breathe. Over time, what's going to happen is your neck and your shoulder muscles are going to get tight. When they get tight, that's going to change your posture. So your posture is going to get worse. When this happens, that diaphragm is no longer in its best position. The diaphragm can't come down to expand, those lungs to expand to get oxygen. What happens? Your respiration suffers. But we're human. The body's going to find a way to breathe. So what happens? We become a chest breather. And then the cycle starts all over again. So if you're having problems with neck and shoulder pain, and you haven't learned how to breathe, again, from the diaphragm, and you continue to be a chest breather, you're going to continue to have neck and shoulder pain. Chest breathing is also associated with an increase in the sympathetic nervous system, and this is the system that's going to raise your heart rate, it's going to raise your blood pressure, and it's going to decrease blood flow to your GI tract. This is your system that is your flight or fright system. So if you want to imagine what this system is, just everybody picture a time you went to a doctor's office and you're waiting for your test results. And you're sitting there and the doctor comes in and says, oh wait, we haven't found them yet, we need to go get them. You're getting anxious, you're getting nervous, your heart rate is rising. This is your sympathetic nervous system. And then when I was preparing for this talk, I found a research article that stated that scleroderma patients have a naturally increase in their sympathetic nervous system. I don't know about you guys, but after living with this for 12 years, I know why that's the case. So we need to find a way to help calm this system down. Best way to do it, easiest way to do it, that everybody can do it, is diaphragmatic breathing. All right. So diaphragmatic breathing is going to trigger the relaxation response. This is going to stimulate that opposite of that sympathetic nervous system. It's going to stimulate your parasympathetic nervous system. The easiest way to think about this is if you want to close your eyes and you can picture yourself on a beach. The weather's warm, or maybe your feet is sitting in the nice cool ocean, or you're in the sand, you're getting a massage. Relaxation music, that's your parasympathetic nervous system. It calms everything down. For me, this one's really important because I also have a lot of GI issues. So if we go back, if our sympathetic nervous system is really fired up, your GI tract's not getting a lot of blood flow. It's going to make your digestion worse. So this is another way, increase in that parasympathetic system, calming the body down, will help increase blood flow to your GI tract and can help with your digestion. Again, this happens through diaphragmatic breathing. So just to review, it's rejuvenating, it's invigorating, we're getting optimal expansion of the lungs, which means oxygen, oxygen, oxygen. It's lowering your heart rate, lowering your respiration rate. So if it's not as high, it means your endurance is going to improve. You're not going to be as fatigued. Okay, so now to teach it, the first thing you have to do is place one hand on your chest and one hand on your stomach. And just continue your natural breathing. Don't change what you are doing. See, when you inhale, see what hand moves more. As you're doing it, if your chest hand is moving more, you're a chest breather. If your belly hand is moving more, you're a diaphragmatic breather. They're probably both moving, but one may be moving more than the other. How many chest breathers? How many people are breathing really, really good for the diaphragm? Awesome. Okay, so in order to go into that diaphragmatic breathing, the first thing you need to do is correct your posture by sitting up nice and tall, getting those wheels aligned. And then how to practice it is by putting both hands on your stomach. And then as you take a breath in, you want your stomach to get bigger. And then as you breathe out, your hands go back in. And it should be very natural, but this is going to take practice. Sometimes it's easier to close your eyes so you can visualize and focus on your hands. So if you want to take a couple of breaths here, as you breathe in, try imagine that you're pushing your belly into your hands. And then as you breathe out, it should just naturally go back down. It shouldn't have any effort going back down. Does anybody have any questions on that part? Okay. All right, just some tips for it. Many of us have been breathing improperly for a long time, so it is going to take practice to do it. Also, it's going to take practice to do it in very stressful situations. Right now I'm working with chronic pain patients, and one of the first things we teach them is diaphragmatic breathing. And I've seen patients come in with a 10 out of 10 pain, 100 heart rate, and just after doing diaphragmatic breathing for 10 minutes, their pain will drop down by a couple of points, and their breathing, their heart rate goes down immediately. So if you are having problems adopting that diaphragmatic breathing, or if you're having problems with your posture, posture, this is where referral to a physical therapist could help you. This is just showing how we would retrain diaphragmatic breathing. Here, you don't have to use shoes, you can use water bottles or anything else. Sometimes it may be easier to do than lying down to see which shoe is moving more. And then if you want to kind of up it a little bit, you can place like a water bottle on the lower abdominal region or a book and spend time trying to make that rise up and down. And you should probably practice this 5 minutes a couple of times a day. The thing we have to remember with our lung disease is that the doctors have this wonderful medicine to save our lives. I know, I'm on 2 of them, Ravacio and Letairis. If it wasn't for that, I wouldn't be standing here right now. But those medicines are not going to improve my diaphragm. My diaphragm is a muscle. It has to be trained. So when my pH got really, really bad, yeah, they started me on a new medicine, but I kind of upped it when I started practicing my diaphragmatic breathing. So the medicines didn't make my diaphragm stronger. It got stronger because I practiced diaphragmatic breathing and was actually able to reduce some of my medicine as my breathing got better. So some simple exercises. Everybody thinks physical therapy is equated with pain or physical torture, but there's some very, very simple exercises that anybody can do just to try and help improve your posture. This is just showing a neck stretch. This is just showing you how to squeeze your shoulder blades back, and this is just showing you how to get your neck in a better position. I'm just showing you these 3 pictures just for you guys to see that it's very simple exercises. Anybody can do them. And I know for myself that if I don't do my exercises on a daily basis, I'm going to tighten up. That's just the nature of our illness. So we kind of talk about exercise. Probably most of us, when we think of the word exercise, we may think of Zumba or The Biggest Loser, or that would be our faces when somebody made us exercise. But as you and I know, for us scleroderma and PH patients, I mean, we can't do that. It's not going to happen. And if we could, I mean, I've tried it, but the next day I can't get out of bed, so it's not going to happen. So what we need to do is we need to change our word, the concept of the word exercise. And we need to redefine it as any meaningful, enjoyable activity where the body is moving. So that may be gardening. It may be taking a walk with a loved one. Probably my favorite, mall walking, shopping. I count that as exercise, as an excuse. The other ones that are great, water aerobics is very soothing for the joints. Tai Chi, there's been a lot of research out there that shows it can decrease your stress, decrease your heart rate, improve your balance. But probably my most favorite is yoga. And you can adapt it to do a chair version if you are having problems with standing up, but you can still get all of the same benefits with the flexibility. Now, we don't want to forget all the activities that we have to do throughout our daily life. Ironing, washing clothes, vacuuming, going to the grocery. A lot of times when I go to the grocery, even if I don't need something down an aisle, I will make sure to walk down that aisle because it's a way I can increase my physical activity throughout the day. So it should be fun. Just get up and move. We have too much stress in our life, too much negativity when it comes dealing with this disease. Try and make it fun. Put some music on, goof, laugh around, play fetch with your dog. That laughter is going to be great. And the point is just to get moving. I loved when the Wii and the Xbox and everything came out because people got up and they were moving. And then sometimes we need to remember what's holding us back. Is it physical or is it mental? try and slowly increase your exercise tolerance is to start doing daily walks, 1 to 10 minutes at a time. And as you improve, start increasing like in 1 to 5 increments until you're getting 10 to 30 minutes, 5 to 7 days a week. This can happen over a period of weeks, months, years. And these guidelines I actually got out of a fibromyalgia article. So I know a lot of scleroderma patients have that pain, that fibromyalgia pain, and one of the biggest complaints is I can't exercise. Well, this has been shown, doing it like this, has been shown to decrease pain and decrease flare-ups. And when you're doing the walking, you also want to remember everything you do throughout your day. So if you went to the grocery and you were up on your feet walking for 10 minutes at a time, that's 10 minutes of exercise. So the best way is to keep a little calendar and chart what you're doing. So I'll have days where I may write 30 minutes of yoga. And the next day I didn't maybe do any formal exercise, but you know what, I went to the grocery. So that's on my calendar as exercise, because I'm up, I'm moving. And this can happen. When I went into liver failure back in 2006, and when I got home, I probably slept 23 hours a day. And I had to start somewhere, right? So I would get up from my bed, walk to my treadmill. I'd have a chair by my treadmill, because that 30-second walk wiped me out. Sit down for a couple of minutes. My goal is I walked a minute on the treadmill. I died after it. Sat back on that chair. But had to rest before I made it back to my bed. My goal at that point was, okay, tomorrow I'm going to walk a minute and 5 seconds. That's how small my goal was. And then over time, I got up back to 10 to 20 to 30 minutes. So it can happen. Which kind of brings me to my next point, is when we're exercising, we need to make small and realistic goals. The biggest problem I see with anybody who's going to start an exercise program is they go from I'm not exercising to I'm going to exercise 5 days a week. I can tell you it's not going to happen. If it happens for 1 week or 2 weeks, you're probably going to stop after that. Make a goal of I'm going to exercise for 1 day. After you do that pretty regularly, make it from an exercise twice a week. But we have to get out of that big goal of exercising, I'm going to run a 5K, when you know within a short amount of time you're not going to be able to do that. You want to make them very realistic, that way you have that motivation. Oh, and this is good too, rest is important. There are days, especially probably after this conference and I'm home on Monday, I can guarantee you that's going to be me. And that's okay as well. So you have to be able to monitor yourself and know that there's days when you just have to be this and not feel guilty for it. So probably what I see as the biggest motivator for exercise is weight loss. And then what happens? We exercise for a week, we go to get on the scale, and we didn't lose weight, or worse, we gained weight, and we look like that. Anybody have that happen? All the time, right? So we didn't lose weight, but we gained a pound, and then if you like me, I go straight to the freezer, grab that big thing of ice cream, don't even bother with the bowl, get the spoon, maybe have some brownies, because you know what, I didn't reach my goal. So I'm gonna, reward myself with more food. When we're trying to exercise, we have to think about a bigger picture. Quality of life, increasing your endurance with daily activities, decreasing your pain. Exercise has been shown to decrease your depression. There's numerous studies out there. Improve your stress levels, improve your body image, your self-esteem, improve your sleep. It was about 2 years ago, my pH got really flared up, and I was on bed rest for about 4 weeks. Finally once I got back started on the terrace, I had to get back exercising again, which was a big daunting task. So dragged my mom with me to the gym, we'd go and exercise, and maybe start really slow on the treadmill, 10 minutes. I'd get home and I'd sleep for hours. And I did it 1 day a week and I was exhausted. I started monitoring how long I napped after I went to the gym. I didn't care if I lost weight. My goal at that point was to not nap longer. If I napped less than, if I came down by 5 minutes, I was improving. Sometimes that's how small your goals have to be. Write them down.